The Early Childhood Development Project Dissemination event with stakeholders provided a platform for critical stakeholders in all the sectors that cater for the needs of children, including the Ministry of Health, the Hospital Management Board, the primary health care level, the Ministry of Education, UNICEF, the World Health Organization, parents and caregivers to evaluate the activities of the group in the last 1 year, give feedback from parents and caregivers, as well as share ideas on how to go about the spread of the program to ensure the early detection of developmental delays and disabilities in every child. While explaining the motive behind the event, the country supervisor of the Early Childhood Development Project, Dr. Oluwatosin Olorunmoteni, stated that ECD has made significant strides in improving the identification and management of developmental delays and disabilities in children, as it focused on building capacity, establishing functional referral system, and creating sustainable solutions for children with neurodevelopmental challenges in 19 primary health care centers, 3 secondary facilities, and a tertiary facility at the Obafemi Awolowo University Teaching Hospital, Ile-Ife. Dr. Olorunmoteni added that the development center in OAUTH has become a model for integrated care, providing multidisciplinary intervention for children with developmental disabilities such as cerebral palsy, autism spectrum disorder, Down syndrome, learning disabilities, hearing impairment, behavioral disorders, attention deficit and hyperactivity disorders, among others, within the newly refurbished facilities.
Common causes of developmental delay: repeated infections, especially when the infections get to the brain and cause meningitis and encephalitis, a major cause; undernutrition, low birth weight, low maternal education, large families and short spacing, and poor delivery practices, which is a major problem in our setting, and we found that a lot while we're doing this study.
In his remarks, the Permanent Secretary of Osun State Ministry of Health, Dr. Isiaka Adekunle, commended the development partners of the project for making Osun the pilot state for the intervention in the entire country, adding that the state government's investment in the health sector has continued to yield positive results, just as he assured the facilitators of the willingness of the state government to have a roundtable discussions on how the Early Childhood Development Project would be incorporated on a statewide basis in all the primary, secondary and tertiary health facilities in the state, and also how the project could be scaled up to the national level. He tasked the initiators to provide a comprehensive report to help the government make informed decisions, since the tools to be used are already on ground. He also added that early diagnosis and intervention can significantly improve outcomes for children with neurodevelopmental conditions.
In this particular early childhood development, the earlier it is quickly recognized and managed, the better for everybody. Better for the child, the family, the society, and indeed the government.
A parent, Mrs. Faridat Adegoke, and a caregiver, Mrs. Adetutu Akinifesi, appealed to the government to help with the free enrollment of children with neurodevelopmental disorders into the Osun Health Insurance Scheme and the subsidization of the drugs. They also spoke on the need for the government to strengthen the capacity of teachers for the inclusivity of children with neurodevelopmental disorders in regular schools.
When I found myself in this journey, if we have a CDC center, a child developmental center available, maybe or probably my son's condition will be better than this. Let's get inclusion into our churches, our mosques, and even our school. We want an inclusion that will go further, that will give more life and more acceptability to these children.
The Early Childhood Development Project is in partnership with Obafemi Awolowo University Teaching Hospital, Ile-Ife, and Royal College of Pediatrics and Child Health, United Kingdom. Oluchi Amuda, OSBC News.